at the 8th Annual PEGS Summit with Dr. Michael Feldhaus, who's the Executive Vice President of Research at Adimab, LLC. Hi, Michael. Thank you so much for taking the time to talk with us today. My first question for you is about the antibody discovery and optimization platform. Now, I know you were instrumental in the development of that. And can you tell us a little bit more about the research that went into it?
The research that went into it actually started back well over 10 years ago with some of the early work on the yeast display system built by Dane Wittrup. And some early work there that we learned going from single chains to fabs. There are certain things we were going to need to pay very close attention to in building this platform. But some of the main things we were paying attention to when we were building Adimab is that from very early on, we were going to build something from basically a soup to nuts approach where it wasn't only having the freedom to operate or IP around library designs, but also the display technology. And ultimately, we wanted to solve the problem that the discovery platform gave you basically the therapeutic entity in its form you planned on using it, which in our case was a fully human IgG molecule. So paying attention to the full picture and building it with the knowledge of 10 years of display technologies really helped us move it forward.
So you guys are using a platform based on yeast display. Obviously, the company started with Dane Wittrup at MIT, and he was sort of one of the pioneers of that technology. And how do these platforms and how does the yeast display technology work with choosing the ideal construct? Do you think it's better than most systems, or are there some hang-ups with it that you found over the years?
What I would want to clarify is the technology that Adimab developed learned from the yeast display technology developed by Dane Wittrup, but in itself is not the AGA2 yeast display system that Dane Wittrup. We prefer to refer to ours as a yeast presentation platform. One of the strengths of using a yeast particle in antibody discovery is Saccharomyces, which is what we use, is a eukaryotic organism, and it has a secretory pathway. So for an antibody to be discovered, it needs to transit that secretory pathway to be discovered. Phage and other systems that aren't in a eukaryotic organism do not have that filter for antibody expressibility and behavioral properties, which will be important when you go to a mammalian cell for ultimate production.
So my final question for you is Adimab is sort of a startup and it's a success story in the industry. And what advice would you give to those starting off in the field of antibody discovery, particularly in the type that you're doing? And what were some of the obstacles that you would run into that you would wish someone had told you about before you started?
It's a good question, and a lot of them in there. But I think about it's the speed of change that comes in an industry. It's not a static industry. There are new developments all the time. Developments are happening faster and faster, and you're not aware of where they're going to come from and how even economic changes are going to influence the environment for your business model. And so in the antibody discovery space, there's the discovery and the technology-focused companies like ourselves, but then there are the end users, those that are going to go in to find a therapeutic. And they have choices on how to work with many different potential providers for their lead molecule identification. And I think you need to think about it. A binder is not a therapeutic. And I think trying to look at it from the start to the finish, from the discovery phase all the way through to the clinic, is pretty important.
All right, well, thank you very much. Again, that was Dr. Michael Feldhaus of Adimab, and I'm Samantha Lewis with Cambridge Healthtech Institute. Thank you.